Tonight we are taking a look at Dr. Mel's long battle with cancer, and we're hearing from people in the medical field who knew him well and say he was quite an inspiration. The passing of our good friend Dr. Mel Goldstein underscores his personal battle against cancer.
Dr. Mel was proactive when it came to his treatment, and as News 8's Jocelyn Memento reminds us, he shared what he learned with others who sought his help.
The diagnosis of a rare bone marrow cancer placed our Dr. Mel Goldstein on an uncertain and uncharted course. He became the public face in the fight against cancer as he fought his own battle against multiple myeloma.
I think that was very calming for people to see him going about his work day after day. Kind of gave them a role model that if he can do it, then I can at least try to do it.
Dr. Dennis Cooper at Smilow Cancer Hospital at Yale, New Haven, was Mel's doctor. It was to Mel's credit, he says, that Mel was one of the longest living multiple myeloma patients.
In fact, he was the one who suggested to me to first put him on thalidomide because he had been reading about some trials with thalidomide. He'd had a bad reaction to chemotherapy, and he went on thalidomide and had a good response.
Mel's mission through the years was to help others following in his footsteps. Proceeds from his books and fundraisers established the Dr. Mel Goldstein Multiple Myeloma Research Fund at Yale Cancer Center.
Dr. Cooper uses those funds as needed to conduct research, whether it be clinical trials, laboratory investigations, investigations in the clinical setting, whatever is required to move the dial on this disease and get closer to a cure.
In recent months, Mel also found comfort under the care of Connecticut Hospice.
One of the things that makes us happy is to have someone come in here, have a sufficient success in terms of managing their symptoms to be able to regain independent living again. And we got that done for him.
Like countless many, home care nurse Karen Scalo was inspired by Mel's unselfish approach.
He would show me letters of little kids who had this illness, who were, following him, and he was following their progression, and they would be sending him pictures, and he was an inspiration for all of all the people he touched.
He is no longer with us to continue his fight, but as a fellow cancer patient pointed out, Dr. Mel's impact is no way lessened. Instead, is likely made greater.
And funeral services for Dr. Mel will be held tomorrow. Services being held at 10:30 at the Robert E. Shore Funeral Home in New Haven. Burial will follow at the Temple Beth Tikva section of Beaver Brook Cemetery in Clinton. The family is asking any contributions be sent to the Connecticut Hospice in Brantford.